right, well, good afternoon. Welcome all you Hawkeye fans to Chat from the Old Cap. Very excited today to have two very special guests, Dr. Brian Wolf, who's the orthopedic surgeon and team doctor for Hawkeye football, and Mark Kaufman, who's the CEO of Athletico. I do want to introduce Mark Kaufman, who's a graduate of University of Iowa from 1986 with a Bachelor of Science. He's the founder and executive chairman of Athletico, which is one of the largest physical therapy franchises in the nation. And of course, he's an athletic trainer himself and has worked with the Hawkeyes and just loves all things Hawkeyes. So Mark, very excited to have you on our program today. I'll turn it over to you.
Thanks, Tony. It's great to be with you all, and hope everyone, yours, the entire Hawkeye family are doing well through this pandemic. But we're excited today to have a wonderful opportunity to talk with Brian Wolf. Dr. Wolf is an orthopedic surgeon that specializes in sports medicine with particular interest in knee, shoulder, and elbow injuries. The Davenport, Iowa native serves as the director of University of Iowa Sports Medicine and is the head team physician for University of Iowa Athletics, along with overseeing Iowa football. Dr. Wolf has been listed as one of the best doctors in America by U.S. News and World Report since 2007. So I have a number of questions to guide our conversation today. And at the end, we should have a minute or two for hopefully a tour, because Dr. Wolf's at the Hanson Football Performance Facility. So Dr. Wolf may have an opportunity to give us a tour of the athletic training room. And but first, I think I'd be amiss not to check in with Dr. Wolf and ask him how things are going on campus at UIHC with the athletes returning and everything COVID-19 related to the University of Iowa. Welcome, Dr. Wolf.
First off, I'd like to say, very appreciative of this chance to reach out to all the Hawkeye fans and give a little different perspective on things. Let me see here.
There you are.
There we go. Sorry about that, little glitch. Yeah, so the coronavirus here for the University of Iowa Athletics has really thrown us for a bit of a loop. As everybody knows, the basketball team was in Indianapolis getting ready to play, and they pulled the plug on athletics. And spring break was going on that week, and essentially none of the students, let alone the athletes, were allowed back into the buildings and into campus. And we've been kind of in planning mode ever since. Right now the facilities are closed, so the athletes can't come into the facilities. But we are making a lot of preparations. We've had some phone calls with the Big Ten as recently as early last week. It's an active conversation. The Big Ten has some committees set up to try to help guide this. There are team physicians involved with that. There are representatives from all the Big Ten universities involved. And here locally, we are trying to collaborate with the other institutions about what are the best practices going to be. Things that we've never had to figure out about are, how do you take temperatures on athletes coming back into buildings, figuring out social distancing, if that's still a recommendation. We'll have athletes coming from all over the country and all over the world. And so we have to figure out if we're going to test every athlete as they come back onto campus, or if we just mandate that anybody that's coming from out of the vicinity self-quarantine for 7 to 10 days, and some of that will be driven by whether we have testing capabilities available. And this is just an active conversation. I think as everybody has gleaned through the news wire and through the internet, these are conversations that are happening daily, and we're just trying to stay on top of things from our end so that when things happen, and hopefully they happen soon, that we have things in place and protocols in place to one, keep the athletes safe, to deal with, and if we have an infection, how are we going to deal with that and trace down contacts and isolate and quarantine, and then make preparations for how we deal with injuries in the setting of coronavirus, things like standing water and ice buckets and things that previously were standard of care. How do we deal with that in a new era where people don't like to have liquids laying around and things like that? So these are all new conversations, and we're working together as best we can with everybody here at the university, epidemiologists, staff, physicians here, as well as our sports medicine group, and then trying to reach out to other institutions and make sure we're sharing some good ideas and best practices.
Well, and I'm sure the audience can only imagine all the conversations that have taken place and have to take place, but wish you well, and certainly your health, team's health, the athlete's health, students' health is paramount, and wish you well through the next few months. And hopefully we get to see some Iowa athletics in the near future. But let's step outside of that and talk about your world. How did you first get interested in medicine, sports medicine and orthopedics in particular, but how did it all start for Brian Wolf?
Well, I grew up in the Quad Cities. I'm from Rock Island, and I was a sports junkie. I've always been a sports junkie. I played basketball through high school, then was fortunate enough to play basketball at Loyola in Chicago. I always had kind of the plan to try to get into medicine if I could. And when I was a basketball player in college, I spent time shadowing my team physician, Preston Wolin, who still practices downtown Chicago. And then my last couple of summers, I did research out at Loyola Medical Center out in Maywood, and just kind of got my feet wet and found I really enjoyed it. And was fortunate enough to get in medical school at Loyola and did well. And when I was going through medical school, I went to my advisor and said, I'm interested in orthopedics. That's kind of my calling. Where should I go? And he said, the best orthopedic department in this area is at the University of Iowa, which for me was music to my ears. I grew up an Iowa fan. My dad had season tickets back in the days before Hayden Fry, when, we weren't that good back in the day. And so I grew up going to games, and I was super excited that when I matched to come back to the University of Iowa, did my residency here, did some specialty training in sports medicine in New York with the team physicians for the Giants and the Mets and the Knicks. And I've been back on staff since 2003. Sports medicine and orthopedics was kind of a natural fit for me. I love being around teams. I love being around athletes. I think I understand the mentality and the culture, having been there to some extent through college. And, for me, it's just a great way to stay involved with driven people who in many ways think a lot like I thought 25 years ago.
So you said you started in 03, and I know you worked with some other teams before landing with the football team and the lead position for that. So talk about that transition from 03 to now.
Yeah, I think in my 17 years here, I've taken care of pretty much every team that's been here. I did start in 2003, 2004, I was taking care of men's basketball. Steve Alford was the coach at the time. And I took care of men's basketball for about 15 years. I transitioned out of that here a couple of years ago. And I've been the head team physician for Iowa football for the last 6 years. My predecessor here and my mentor, Dr. Ned Amendola, who I worked with closely, I helped him with football in the years before that, but he unfortunately moved on to Duke University 6 years ago, and I ascended into his position. I loved working with basketball. I did both for 3 or 4 years. It just got to be a bit too much. And I also I have some partners that do what I do. And I think it's a great opportunity for all of us to be involved with teams. So, I was a basketball guy. I knew everything about basketball, having played at the college level. It's been a learning process, quite honestly, for football in some ways. A different mentality. I kind of equate basketball players are kind of like our skill players in football. I think of basketball players as, they're ultra athletic, kind of like our wide receivers and running backs and defensive backs in football, but they're very different than our offensive linemen. I think there's also, there's a different level of injury. So injuries are extremely common in football, unfortunately, but it's part of the game. In basketball, it's a little bit less common to have injuries that are significant or where athletes lose a lot of time. And that was an adjustment that I had to take in helping them deal with it. And I was glad that I was working with Ned Amendola during the time. And I think it is something that you learn as you spend more and more time around the football players. But, just a case in point, recently we've had a player that went through a really bad knee injury, and you feel for the kid. And this is a football player, and he's, going into one of his last years here, and you feel bad, and you're talking to him about it. And in a very mature way, he kind of looked at me and says, "Doc, it's okay. This is part of football." I think in some levels and it reflects, I think, some of the messaging that they always get and what the culture that they're around. But it is a bit of a different, it's a different environment very much. And And it can make it challenging too, because football players will try to play through almost anything. You know, they could have their leg falling off and they will try to play if you let them in some circumstances. And so that's also, not to say that basketball players aren't tough, because some of the toughest guys and athletes I've ever taken care of play basketball, but I think it's a little bit more prevalent in the football arena.
Yeah, they should probably have a course in medical school on how to deal with offense and defensive linemen. That would be helpful for a lot of people, I'm sure. But being in Chicago here, I need to mention that the University of Iowa Hospital and Clinics are top 5, top 10 programs in pediatrics and adult medicine in the country. I often have to remind some Chicagoans that one of the best medical centers is about 3 hours away, but you are part of a fantastic team, and one of the true treasures for the state of Iowa is at UIHC. So talk about being with the athletes and managing the balance between a success of the football, basketball programs and the care of the athlete. That's again something they don't have many courses for in medical school. And how do you develop not only the relationship with and the confidence with the athletes you're treating, but also the coaching staff, administration, and so forth?
Yeah, it's a great question. It isn't anything that you've ever been taught. And, like everyone else, you become a fan, you become attached to the team. As a team doctor, you want to see the team do well, and you want athletes to do well. So, part of the process really has to be that you have to dissociate being a fan and, thinking about outcomes and things like that from what's right for the athlete at that given time. And I've struggled with that in terms of you want to always, it's very stressful. So when I get stressed out about what's the right thing for this athlete, I usually kind of come back to what would I do if this was my 18-year-old son? What would I do? Knowing the big picture, knowing what's going to be good for that player that day, but also 5 years from now, 10 years from now. Because the heat of the moment really can mix judgment. It can mix up, decisions. And you really want to do, really kind of taking a look at, is it safe? If there is an injury, but is it safe? And if the athlete does continue to play, are they going to risk screwing something else more? And if the answer is no, then you try to help them get back and compete, even though they have a bit of an injury. If there's a risk involved that, hey, this could get a lot worse and it's going to change outcome or change prognosis for that player next week or next year or 10 years from now, then that often makes the decision easier. And we are extremely blessed here in that our coaches are extremely respectful of the medical process. There is no pressuring to do things. They're very supportive of our medical staff and decisions that we make. And we're very, very blessed that way because I have a lot of colleagues in this field around the country. And I do think there are pressures placed on team physicians and on the medical process in some circumstances, which would make that decision-making more difficult. It's already difficult because a lot of what we deal with is not black and white. Some things are black and white. If an athlete breaks his leg, that's a black and white deal, right? He or she is injured, she can't play. That's pretty straightforward. But there's a lot of gray area, sprains, ankle sprains, some shoulder separation things, and some of the common things that we see in football have a lot of gray to them. And it's making a judgment about, big picture for the athlete, making sure they're effective, and making sure they're in a situation where they're not going to hurt themselves further and be able to still perform at an adequate level.
Mm-hmm. So try to backpedal to last fall or fast forward to this fall, hopefully, and talk about what during the season, what your normal week looks like. I know orthopedic surgeons like yourself spend time in the OR, in the clinic seeing patients, research, administrative, and then also time with the athletes and games. So what does the breakdown of your weekday look like?
Yeah, so it's a bit of a crazy schedule, I think, especially during season. But one thing that I often hear is, there is a perception that if you're a team doctor, all you do is take care of the team. And probably 5 to 10% of what I do is help take care of the Iowa athletes and the Iowa teams. And the other 90%, I have a normal orthopedic surgery, sports medicine practice. I see patients from all around the state and the region for a variety of problems, 8-year-olds all the way up to 80-year-olds. So I'm in clinic typically 2 days a week. Was just in clinic today, and I'm in surgery 2 days a week. I have a 5th day that is kind of a wild card day. It could be a day if we're in the fall. We could be traveling for football on Friday. I do a lot of educational and academic things where I may be going to speak or going to a meeting or do research. And I do have a fair number of administrative responsibilities for sports medicine and for orthopedics, where I get a lot of those things done on that 5th day. And then if things come in during the week and we have to get a more urgent operation done, then that wild card day could turn into another surgery day.
What is game week or game day, travel or home look like for you and the Hawkeyes?
Yeah, so practice week for the football team does have kind of a direct correlation with what my week looks like. Our football team here, they typically practice Sunday through Wednesday. So the day after a game, we would have an injury check. So I would come in on Sundays, typically around 11 o'clock, and anybody that was injured the day before would check in, and we'd start to put together a plan for treatment or further testing or any other interventions that we need to be doing with that player. But if they're not injured, then on Sunday the team would practice, and those players that played quite a bit on Saturday would probably do some light workout, but those players that didn't see much action would have more of a practice. Mondays, Tuesdays, Wednesdays are kind of a normal practice, and since 2015 the Iowa football teams practice in the morning, so they typically practice around 8:30 to 10:30, and Tuesdays and Wednesdays are the day that if there's going to be some contact, some hitting in practice, those are the days that happens. And I'm typically I stop over to the training room typically after every practice, and for sure on Tuesday and Wednesday to check in on things. The football team takes Thursdays off, so that's a rest day, and that's been that way since, again, 2015. And then on Friday they do what they call a primer, which is really driven by our strength and conditioning coaches, Coach Doyle and his team, to kind of get the athletes moving again. And then they'd have what they call a walkthrough, which is really kind of a run through, where they run through a lot of situations and plays and kind of getting their rhythm back in preparation for game day. If it's a home game, the team would go up to any of the 85 that are dressing would go up to Kirkwood, the Kirkwood Hotel up south side of Cedar Rapids, and they stay in the hotel the night before the game. And then typically at the stadium 2 hours before the game on Saturday, whether it's home or away. If it's an away game, then we typically are boarding the buses to go to the flights, and the flights are usually charter flights out of the Cedar Rapids Airport. And we would leave around noon on Friday and stay somewhere close to the stadium, wherever we're playing at.
Sure. I mean, you don't have to go through names, but categories of who the other members of the sports medicine team taking care of the Hawkeyes.
Yeah, so we've got a huge team these days, and it's been really, really fun to kind of build the team together. We have 3 others like myself, Doctors Westerman, Dukeman, and Bollier, who do orthopedic sports medicine. So there's 4 of us that are surgical, and then we have 6 non-surgical sports medicine specialists. Everybody is specialty trained. A lot of us have a niche. So Dr. Westerman is our hip specialist. Dr. Dukeman does, kind of ankle surgery. We have a concussion specialist in Andy Peterson. We have people who specialize in things like PRP and ultrasound procedures with Dr. Hall and Cruz. Dr. Markison does a lot with running. And Dr. Thompson also spends time in the ER, and Dr. Woodruff, who does women's health. So we have a big team of 10 physicians. Every team at the University of Iowa has 2 of us that are assigned, one surgical sports medicine specialist and one non-surgical. The team gets a lot bigger after that. We have, a group of 12 athletic trainers that work at our clinic, and then another group of 12 staff trainers that work with the University of Iowa athletes in the athletic training room. And as you know, with your background, they're here all the time. That's who works with the athletes on a day-to-day, hour-to-hour basis in terms of injuries and rehabilitation and preventative measures. And the sports medicine team over the last few years has grown. We have 2 sports psychologists that just work with University of Iowa athletes for mental health and for sports psychology. We have 2 nutritionists that just work with University of Iowa athletes, working on meals and snacks and helping the athletes to eat right and replenish fluids and replenish their bodies with nutrition. And then there's the whole strength and conditioning team, which they almost serve more like coaches, but there's a lot of interaction between the sports medicine side and strength and conditioning.
Mm-hmm. So I was at Iowa 30 plus years ago. My daughters referred to it as the Stone Age for sports medicine. What's changed? Give us a couple examples of in your career during your time at Iowa, some things that have changed, or you still think about, wow, how different how different things are today versus when I started my career.
Yeah, that's a good question. Certainly the technology has gotten so much better, even over the last 15 years. And when I say technology, MRI these days compared to 15 years ago. And I think we're a little quicker to use testing like MRIs these days, where we want to get information fast. And, if it helps us guide treatment and plans and prognosis, that certainly is something we're more apt to do it and a little quicker to do it now than we were 17 years ago when I started. We have other things that have come up, things like PRP, which is platelet-rich plasma, and other biologic injections. So if we have tendinitis problems or some cartilage problems and things like that, we have a biologic way of trying to inject something into an area to see if we can help it calm down in a more biologic way rather than a cortisone injection, which was a little bit more common 15 to 20 years ago. Some of the disorders that we deal with that we didn't even know about 17 years ago, things like athletic pubalgia or a sports hernia. I mean, that was nothing that we knew about. And it's a very common thing. We see it in our football kids and our soccer players and other athletes. Hip problems are much more known about, and we can help treat those better these days than we could 15 years ago. And then in the non-medical thing, I think the whole realm of athletes and parents and things, I think that's changed. I certainly make a whole lot more phone calls these days than I ever did in the past, to the point that now when we start talking about treatments or potentially surgery, it's mandatory for me to tell that athlete, hey, I need your mom and dad's phone number. Who do you want me to call at home, to make sure everybody's in the loop? Because I think there's more want and more need of information for families, and it's hard. I have a college sophomore, and getting information out of him can be really challenging sometimes. So, and I'm sure it's that way for a lot of parents that have athletes that are sometimes hundreds and thousands of miles away. And so we are certainly more proactive these days to make sure that everybody is kind of in the loop about what's going on and head off any questions or problems on the front end.
Yeah, thanks for that. So I know you were going to try to give us a little tour. So maybe while you're doing that, setting up or getting mobile, you can, we all have our Hawkeye memories, but if I ask about the highs and the lows for a head team physician at the University of Iowa in your tenure, what comes to mind?
Highs and lows. Well, I'm walking around here, so I will. I got to go turn the lights on. They all turned off here on me. So certainly one of the highs would be the 2015 football season when we went 12-0. The locker room after we beat Nebraska to go 12-0 in Lincoln was super fun. I would say that was immediately followed by one of the all-time lows that we had that I've ever seen. I've been in locker rooms since I was 7. And so the locker room after we lost to Michigan State in the Big Ten championship game was probably the toughest locker room that I've ever seen or experienced. Those guys were gutted. They left it all out there. A lot of them were playing, with nagging injuries, and they just left it all on the line. So, and they were really devastated when it just didn't turn out the right way. So that was probably one of the bigger lows that I've ever seen, but I've been really fortunate. Last year's women's basketball run was magical. Great group of girls to be around. I was there in 2005 when we won the Big Ten Men's Championship tournament. That was an absolute blast. The last 3 bowl games for University of Iowa, and getting to see them do the hokey pokey last year after the Holiday Bowl was emotional. You know, on a lot of levels, because I remember that back in the day when I was a kid watching those kids do that. And you know, one of the things that I told Tony about in prepping for this is one of the harder things for me is always senior day, because I know what those kids have been through. Some of them I've gotten to know way too well because they've been injured, and when they're kind of wrapping up their career, you know, it's very gratifying, but it's I find that to be a tough day because you get to know a lot of these kids really well and you know what they've been through. So yeah. I'll give you a little tour here of the this is the Hanson Performance Center. So this is where we do a lot of our athletic training. This is just down inside. It's in the lower level of the football complex. This would be where all our tape players come in, and when they get taped and get prepped for practice, we have a whole area over here where people get treatments. This would be a little bit like what you see in a physical therapy clinic, where we have, you know, these are all laser machines and ultrasound. We have compression devices. And this facility, when it opened here 4 or 5 years ago, really gave us a lot more space, and just the amount that we can offer the athletes is really amazing. For those athletes that are recovering from injury or surgery, we have a rehabilitation pool. So this would be a pool that has a couple different depths. So it allows us to get them running or jumping with a lot of their body weight supported in a pool setting. There's a couple of whirlpools over there kind of beyond the dark windows. And those are usually crowded after practice, where the players are helping kind of get their muscles relaxed after they get done. There's a rehabilitation area over here where our players, again, when they're doing their rehab programs, and they'll have a whole program outlined by the athletic training staff and the physicians, and they'll come in here, and this is some turf, so they can simulate turf for a lot of the lower body activities that we have them doing. And this is almost a complete physical therapy gymnasium, where a lot of the athletes will do their strength and conditioning and their recovery before they get ready to transition over to the weight room across the hall with Coach Doyle. So this would be where we try to get them tuned up enough to get back into the weight room. And then in the back here, we have our physicians area, and we're very fortunate with the new facility. Again, the lights turned off here. So we have basically a physician's office here, where we have an x-ray unit. So if I have a player that we need to get an x-ray of a hand, ankle, shoulder, that's all readily available right here in the building. We take that to Kinnick on game days. It also goes on the road with us on the road. So we always have x-ray available in our locker room to help us. Physicians tables, we actually have a full board pharmacy that within the building with 110 players, and then another 30 or 40 support staff. We work with the University of Iowa pharmacy people to kind of do a full-fledged pharmacy here so we can provide most of the prescriptions that we need for players right here in the building. And it saves them a little bit of time and hassle, and that's all kept under lock and key and monitored and guarded and whatnot. And then this is the room where I was doing the interview early. This is our conference room, and this is where we meet on a weekly basis during the season in spring ball with Coach Doyle and Coach Ferentz. And it's one of the unique things, I think, at the University of Iowa, that we get a lot of FaceTime and direct meeting time with the coaching staff to make sure we're all on the same page as we make plans for the athletes for the coming week or for the season, and kind of talk about the big picture for all the different medical injuries that are going on.
Great. Thanks for taking the time to do that. I'm sure a lot of people on have never seen that. So we have a few questions that are coming in. I want to rapid fire through them as much as we can get through. So first question, did Dr. Wolf play for Coach Duncan Reed?
I played against Coach Duncan Reed. So Duncan Reed was a legendary coach at Rock Island High School. I went to Rock Island Alumni, which was the Catholic school in town. So I played with a coach by the name of Bob DeDonker, and unfortunately I never beat Coach Reed and his Rocky teams, but they were really good.
Got it. Your role for on-the-field injuries, how does it work?
So on the field injuries, our methodology here is that our athletic training staff are the folks that go out and evaluate the player on the field. So if we have a player down, the athletic trainers go out and take a first assessment. We have a series of hand signals and gestures that alert us. So as that player is down, you'll see myself, Dr. Andrew Peterson, who works with me in football. We have a couple of fellows with us there. If somebody's down, we kind of start to make our way over to that area, that yard marker. And if we get a signal that kind of looks like a sideways D, then the physicians go on the field. But if at all possible, we want to get the player off the field without a lot of people being out there. Certainly situations would be, neck injury or back injury or broken bone or dislocated joint. Then we're going to get the physicians on the field, and I'll run out and we'll help assess the situation and figure out the next step. But usually the athletic trainers would assess the situation, and if it's something we can help the player off and take a look at it on the sideline, and we have one of those medical tents that we can flip up and look at them there, or we can get them up to the locker room, then we would assess those things on the sideline or off the field if at all possible, to try to deal with it in a little better situation.
Is the athletic training room co-ed?
The athletic training room is co-ed. Absolutely. We are actually, our head athletic trainer for University of Iowa football is a female, and we have one of our other head trainers for football is a female. So yes, it is a co-ed facility. People have to be clothed and decent when they come in here, but absolutely.
Great. How has helmet technology progressed?
I think they keep trying to progress it. It's still, and I would defer to Dr. Peterson, who's again my concussion partner, who is really our expert on that, and Greg Morris, who's our equipment manager, is very tied into the helmet technology. But certainly every year they are tweaking things. We were probably, I think, the first university to have every player has a customized helmet where they get the geometry of their head is scanned. And so everybody, it's just like you wear a size 13 shoe or a size 14 shoe, and if the insole was actually molded to your foot. So each helmet was specifically fit for each player, and we were one of the very first, if not the first, institution to do that. And we're still evaluating that. That's been a new process over the last year to see if that changes concussion rates and injury rates. But it is a yearly process where new things are coming out to try to limit that risk of concussion and head injuries.
Last two questions, I'll give them to you at once, and then we'll turn it over to Tony. But first is, our coaches, what are the requirements to disclose injuries before the games? And the last question is, how does the athletic training room you just gave us a tour of compare to others you've seen in the Big Ten?
So the first question about disclosing injuries before the game. There is not necessarily a rule. There's been a lot of discussion over the last couple of years about trying to make collegiate football more like NFL football. So NFL football certainly has something in place where there has to be an injury list, and there are certain terms that have to be used: out, questionable, possible, and so forth. That is variable, I think, across institutions and across conferences, if you will, in college football. And there is certainly still a gentleman's rule that, injuries should be disclosed. Now, the amount of information that is given out is really per the discretion of the medical team, the coaching staff, and the university. And to protect the athletes, we generally err on the side of trying to release less information than more. And then, Mark, you're going to have to help me on the second question. I forgot it now.
How does what you just showed us compare to others you've seen in the Big Ten?
Yeah, I think our facility is fantastic. And I would say that our football facility is as good or better than any other football facility that I've seen in the Big Ten. Now, there's probably only been 5 or 6 of the other facilities that I've seen, because we're at a practice facility now. And a lot of places, the practice facility is not necessarily the game facility. So our training room here would not be the training room that we use on game day. I will tell you that the locker rooms and the training rooms that you get on the visitor side has a whole spectrum of how modern or unmodern they are, depending on where you're playing. And but I think, what they've done here with this facility is just remarkable, and it's made a huge difference, I think, for our athletes and the care that we can provide.
And those visiting locker rooms aren't a pretty pink like we have at Kinnick Stadium either. So
yeah, ours is a pretty nauseous pink, and there's some pretty nasty brown associated with the pink, but it's a nice locker room. it's not falling apart, and it's not a cement wall with a nail in it. So it's a nice locker room.
Well, listen, really want to thank you for your time and giving up some of your day here. It's an important area, unheralded area is sports medicine, and some don't get recognized as much as the good work that you and the team do. So thrilled to be part of this. Great to have you on, and I'm going to turn it back to Tony, and he can tell us what we have coming up.
Thanks, Mark, and thanks, everyone.
Excellent. Well, thank you both. That was absolutely fascinating. What I loved about that is for most of us on this call, we'll probably never step foot in that training room, and to see what goes on and to hear what goes on in there is really interesting. So thank you both for sharing that with us. I do want to do a quick plug for our next chat from the old cap, which is going to feature BJ Armstrong. In the chat on this call, I just put a link for you to register to go listen to BJ Armstrong. And if you've been living in a cave for the last few weeks, you might not know that BJ Armstrong is a 3-time NBA champion, 2-time All Big Ten honoree, team MVP, ranks 5th all time at Iowa. And he's going to be talking about his career at Iowa, his career in the NBA, and also talking about The Last Dance. So if you want to register for that, that is in the chat there. So Mr. Kaufman, Dr. Wolf, really can't thank both of you enough for doing this. Really appreciate it. It's really given us all some really cool insight and just an excellent view of what goes on to make our favorite athletes from the University of Iowa healthy, wealthy, and wise, and able to compete out there each and every day. So thank you both for everything that you've done for our student athletes and for our university as a whole. We really appreciate everything you've done. We wish you nothing but the best in moving forward. This call has been recorded, so we'll do some editing and put it out on our YouTube channel. So anyone that came in late or had to leave early, we will put this out shortly, and you can share it with your friends and family. So
Thanks,
with that, thank you.
Thanks.
With,
Go Hawks.
Yep, with that, I will end this call for everybody on Iowa. Go Hawks. Everybody have a great afternoon.